Assalamu alaikum. My name is Tahir Shafi Khan and I am a plastic surgeon here at South City Hospital. I have over 20 years of experience at the Aga Khan University and a couple of other hospitals in the city. But I am now full-time at South City. You can find me here any morning, and my clinic is a walk-in clinic, so no appointments are necessary. Plastic surgery itself is a vast field where, broadly speaking, at one end you have reconstructive surgery and at the other you have aesthetic or cosmetic surgery. While I do a little bit of reconstructive work here at South City, the primary focus of my work is cosmetic, and I offer the full spectrum of conventional cosmetic surgery here. Among the procedures that I feel adept at are primarily rhinoplasty, facelifts, abdominoplasties or tummy tucks, liposuction, baggy arms, baggy thighs, all the full spectrum of breast surgery, which would be augmentation, reduction, reconstruction. Equally, a procedure that is, in my practice at least, increasing in numbers is male breast surgery, gynecomastia, where young men find that their lifestyle or the way they are able to enjoy life is severely inhibited by the size of their breasts, come in, get sorted in a simple daycare procedure and live happily ever after. I've incorporated in a facelift this recent procedure called microfat tissue transfer or nanofat, which is stem cells. Essentially, in an aging face, the descent can be corrected with a facelift. The deflation can only be corrected, and this is necessary because as the face ages, you get that sunken, hollow appearance to the face. By taking fat from the body, patient's own body, processing it while the patient's on the table, and then injecting it in perfect or near perfect symmetry, proportion, you can change a result that is good into near perfect. And the potential of further processing the fat to harvest stem cells called nanofat rejuvenates the skin if injected appropriately. Having said that, the operation that I enjoy the most is a rhinoplasty, which is in common vernacular called a nose job. In a nose job, a patient comes to see me because they're unhappy with the appearance. If there is a significant problem with breathing, then I involve my ENT colleague, Professor Tariq Rafi. But if it's a purely appearance-related issue, then I'm very happy to go ahead and operate, provided there is a clear understanding between the patient and myself of what it involves. Because no plastic surgery procedure is 100% fail-safe. And I think this applies not just to rhinoplasty but all procedures. It's very important that any patient has a full and frank discussion with his or her surgeon prior to agreeing to have the surgery, because there are always pros and cons. So it's very important that you seek out someone for your surgery, because it is a leap of faith, someone you can trust who will lay out the entire picture in front of you and let you decide. And after a frank discussion, I can proceed to improve things almost without exception. In conclusion, what I'd like to say is that any cosmetic procedure, while very attractive on the outside, carries pros and cons, and it's essential that there is a frank and full discussion between the surgeon and his or her patient to decide whether this surgery is merited, and to proceed only if there is a full understanding of what it entails. Thank you.